when you talk about health equity, it has many factors. It can be racial, it could be disabilities, it could be LGBTQ, or it could be just some of the social determinants that restrict people access to healthcare.
I've always felt the most rewarding experiences for me were when I was caring for people who are underserved or people who have barriers to care. Our patient population, I think, is probably one of the most diverse in all of Massachusetts. A lot of people get rented out, or the rent is too high in Boston, so they kind of move out here. So I think a lot of patients here are foreign-born, speak many, many different languages.
As a mentor and leader in the community, one big thing for me is, being a young black male. There aren't many young black males in medicine, and my goal would be to just be a role model, to get out into the community, to volunteer and do as much as I can to show other people like me that these things are possible.
We talk about being mission-oriented, that we care about our communities as a whole, the whole community, including our vulnerable populations, and being public really holds us to that. The residents feel the whole mission. It's in how we address people, what we consider for programs, so the resources that we have, or the lack of resources, and how we are creative. What's great about the residents is their energy and their creativity helps make us better. So it's a win-win, really, I think. The health equity piece, in my work I've realized that if we don't talk about some of the basic structure of what causes some of this, and a lot of this comes from racism, then we're never going to get to better solutions. We're never going to figure out how to improve our population health numbers if we're actually not digging deep into the communities and the disparities within the communities. It doesn't really matter what medication we give a patient if we're not considering everything around them in their neighborhood and what's in their home and what do they have access to, whether they'd even trust us given the historical aspects before where people were taken advantage of because they were vulnerable.